My Doctor, your health anytime, anywhere.
Hello, lovely people. Welcome to the My Doctor podcast. Thank you for tuning in. So just to give you a summary of what we do on this show. So we host various doctors. We notice that the community has very many misconceptions on health. There's so many health issues that they don't have knowledge about, or they have little knowledge about. So we host various doctors to talk about these topics, clear those misconceptions, clear out the myths. Yeah. So last week we had lovely Dr. Sabrina who talked about adolescent health. So if you've not watched that episode, please go and watch it. You will learn a lot. And this week we have another topic. But before we go into the topic, my name is Mwesigwa Joy and I'll be your host for this show. So our topic for today is myths on UTIs. You know, UTIs are very common in our society and everyone seems to think that they know something about a UTI, which could be true or could not be true. So today, our guest for today is called Dr. Lawrence Mugisha. We chose him because he has a lot of knowledge about UTIs and is going to really clear out our misconceptions, give us the knowledge that we may need before we go to the hospital and everything. Yes, you're very welcome.
Thank you very much for inviting me to the Doctor Podcast and to share the knowledge I've gotten and experience in my practice, especially on the UTI. When you told me that I was going to talk about UTI, I was fascinated because on average I treat, I'm the director of Cure Medical Center. I've been working at Cure Medical Center for the past 18 years. So on average every day I meet 2 to 3 ladies. Every day 2 to 3 ladies with UTI. I would put it UTI in quotes because some say they have UTIs, of which I would explain why they say they have UTIs and yet they don't have UTIs. Some really do have UTIs, okay? Then I will also clear the myths between UTI and STD because I normally get ladies who have UTI, okay, and they drag along their husbands that you must get treatment because I have an infection. Actually, for them, they call it infection. It is us who call it UTI, okay? And some think infection is a word used by us to maybe make money. The moment you mention the word infection, the lady will say, I knew infection, okay? And yes, literally, according to them, they think infection is shared in between 2 couples who sleep together. And normally, that's not the case, okay? I will also come to that. And also, I will tell you the routes through which the UTIs affect especially females and why females are more susceptible to having UTIs versus males, because you will find out of 10 people or you treat, or 10 patients you treat of UTIs, 2 have similar symptoms, and why it is not common for a UTI to be in a male. Mainly they have STDs, okay? Yeah, so I will tell you the difference between an STD and a UTI, okay? So and the routes of transmission and the symptoms and how we, the medical fraternity, has really misused antibiotics in treating the UTIs. When I say UTIs, I mean it is not necessarily a UTI, but you go ahead and hammer a heavy antibiotic. Maybe you want to make money. Maybe you have made a misdiagnosis in trying to alleviate. And poor lady with no knowledge of what is going on or what a UTI is just obliges. That is why you're going to find in arcades, these shopping malls in town, most you'll find ladies walking with cannulas. You've seen them. Cannulas on what? And most of those people, out of 5 ladies you find with a cannula, 4 have UTIs. Maybe the others have maybe malaria, but mainly if you have malaria, you can't work. But people with UTIs still carry on with their what? So you find ladies with cannulas. It is a very common happening these days. And either they are being given treatment that is not necessary, because even if you have made a very good diagnosis, even an oral treatment is enough.
Can work.
Yeah.
So before we go deep into the topic,
Sorry, I went for but it's okay.
It's okay. So someone out there may not even know what a UTI is. They could just know the word UTI, but could you like explain to the people out there what a UTI is in simple terms?
In simple terms, well, UTI in full is a urinary tract infection, but a layman may not be able to describe all those three words in combination to make the right diagnosis. For them, they just call it infection. And what is an infection? So first of all, you need to understand what an infection is. An infection literally is an infectious agent accessing your body. It might be on your body, but naturally it is there on your body. But if it accesses another part of your body, say for example, I have normal microorganisms within my what? Within my oral cavity, okay? Some people go down, you get? And then I will have introduced the normal microbiota, the normal organisms that reside within my what? Mouth, and then I introduce them to another part of the body where they are not what? Normally supposed to be. And when they reach there, you'll find totally a very comfortable ground for them to flourish. And then you end up having the UTI caused by the normal what? Flora that has accessed a different part of the body and has started to multiply and cause disease. So So that word is an infection, an infectious agent accessing your body and causing disease. But not necessarily, it may not cause disease because of our immunity that keeps it in check, okay? But when it reaches a certain amount and the checks are not there, then it starts causing disease. So if that infectious agent has affected these parts, then it qualifies to be a UTI. So which ones are these parts? Number one, it must be the urethra. I don't know whether the masses know what the urethra is. It is a small opening within the penis. It is like the tip, that hole that you see on the penis. That's the urethra. And it continues, okay, into the bladder. Actually, it is a passage through which the bladder empties urine to the outside. That is the urethra. So if the urethra gets infected, that is a UTI. The bladder gets infected, that is a UTI. The ureters get infected, that is a UTI. The kidneys get infected, that is a UTI. So the sequence of ascending infection via the urethra upwards up to the kidneys is a UTI. And it is different from an STD. So those structures compose a UTI. And both present differently in signs and symptoms.
So what are the common signs and symptoms of a UTI? If I'm home, how can I know that, this could be a UTI?
You see those structures I've mentioned? Yeah. Each presents differently if there is an infection within that part. Say, for example, if the infection has started and it is in the urethra, the number one sign you're going to feel like burning sensation as you're passing urine. Yes. And on top of that, you might feel pain as well as you're passing urine, okay? Then as it ascends, you might also feel some itching on the part, like, sorry, I didn't tell you where the urethra of the woman is. It is on, if you're to see the woman's reproductive organ, on top, you will see some tiny opening. It is, some people confuse the clitoris and the urethra. Yes, they are neighbors. But below it, you'll find a what? You find a tiny hole. Above, you'll find the clitoris. Below it, you'll find a tiny hole through which it communicates to the bladder. So you'll find below though it is very hard for you to differentiate when you're scratching and itching. You might itch the whole structure, the clitoris and the urethra. But normally, the center, the focus is around the urethra. You might start itching a bit and then passing a burning urine. You feel like you're burning. And then the urine comes in small bits, and I will explain why it comes in small bits. Then you might also, as it ascends upwards, now it has reached the bladder. Now, you know the bladder is within what? The layman call it echiwato in Uganda, but in English, the pelvis, the pelvic part down, lower abdominal pain. The lady will come complaining of a lower abdominal pain, okay? Then that means now the infection has ascended. Ascending means going up, has ascended and has reached the what? The bladder. And when it reaches the bladder, now we call it a cystitis, okay? Now, when the bladder has gotten an infection, like your finger can get infected and it swells, okay? Like if you can see it inflamed, it swells. So likewise, the walls of the bladder also what? Inflame. Now, when they inflame, they start getting like false stimuli to pass urine, even if the stimuli of it voiding urine isn't yet, because it is supposed to be on a stretched full bladder. You get the urge to go and pass urine, but this time you'll get a false urge to pass urine, even though the bladder is not full. Say, for example, you need 400, 500 mils of urine to pass. But even if it is 100 mils, because it has landed into an inflamed, so you get the urge. So you go and pass little urine, okay? So the patient is going to come and tell you, I pass little urine. I pass little urine every time I do what? I go to the, and it is very painful. So that means that every time it is maybe 100, 150 mils within the bladder, you will be getting the urge to what? To go and pass an urine. So that is the other sign. Then as it ascends up the ureters are two that drain urine from the kidneys into the what? Into the bladder, okay? Now there someone starts complaining of backache. Yes, and it is synonymous with a patient complaining of lower abdominal pain and lower backache in a UTI. Mind you, do you know the incubation period between when you get the infection and when you start presenting signs and symptoms? It is within hours. 6 hours, you've started having those what? Because the moment those microorganisms reach a fertile place that has not been colonized, they flourish. So they reach up in the ureters and you start having backache. You know the position of the ureters. Yes. And as it ascends up, it reaches now the what? The kidneys. Now when it reaches the kidneys, now it's like maybe the third day, fourth day, the patient starts complaining of systemic symptoms, fevers, general body weakness. And if he's a health-seeking person who waits for much worse symptoms to appear, he will even come complaining of fever, general body weakness. And he lands on a doctor who is not very keen on taking history to find out how it started. You find someone on anti-malaria. You get. Yeah. But when the infection, the UTI is busy flourishing, by the time you notice that someone has a UTI, not the malaria has been misdiagnosed. Remember, when someone is maybe diagnosed with malaria, they rush to painkillers. So the symptoms are being what? Suppressed. The infection is flourishing. You're hammering someone with the wrong medication, anti-malarials, simply because you didn't even investigate very well. Maybe the lab is not well equipped. Maybe the knowledge is also lacking. And guess what? Someone gets AKI. AKI is an acute kidney injury, a complication of the UTI. So those are the signs of UTIs. If I don't know whether I broke them down
very well,
piecemeal of how a patient can present with UTI.
Okay, so in summary, tell us some of the causes of UTIs so that someone out there can actually avoid getting one.
Thank you very much. Actually, the cause of UTI, unfortunately, we live with it 70 to 80% of the causes of UTI is our normal flora that we have. And mainly, it's called E. coli. I don't know whether the masses know what E. coli is. E. coli is a normal flora. When I say normal flora, is the microorganisms that we live with, okay? We benefit from them, they benefit from us, okay? But then, once these microorganisms, like I had earlier said, once you aid them into shifting from where their home is, and then they find a new colonization, then they can cause disease. So E. coli is a normal flora within our alimentary canal. Everyone understands what an alimentary canal is, but mainly in the rectum. So that's where they normally reside. So meaning that they can easily come along with what? With stool. Okay? Now, I pity people who go west. As in, the rectum can never be what? Free of E. coli. Yes, but there are people who go into the rectum. And then they come out. Now they aid the E. coli, and now they put it into the vagina of the female. And now that is, you have aided it, okay? But mainly, females have 5 ways of how they get this UTI via the E. coli. One is hygiene. How do you clean yourself? If I would ask you a question, how do you clean yourself? As a female, do you know how to clean yourself? Naturally or anatomically, you are susceptible to getting a UTI more than me, a male. Basing on the fact that E. coli resides within the rectum, and the rectum connects to the anus. And you know the centimeters that are between the anus and the vagina? Very few centimeters, like 3 or 2 centimeters. And you know the centimeters that are between my urethra and my anus? It is a whole kilometer. So how does E. coli access my urethra? Very unlikely. How does the E. coli access your urethra? Very easy. Very easy. So number one, how do you clean yourself? You are supposed to be cleaning from front backwards, okay? But we are getting UTIs even as early as 5-year-old girl, simply because they don't know how to clean themselves, okay? So front to back hygiene is very important in controlling UTIs in females, if you know how to clean yourself. 2, I have had a misconception that toilets cause UTIs. I haven't done a research, but most women who have UTIs blame them on toilets. Someone can tell you that I've spent a month at home. I didn't have the infection. The moment I went to town like this and I used the public toilet, I got the infection. Now, I pose a question and say, yes, you squat on the toilet. Which direction does the urine flow to the toilet? Do you want to tell me that the microorganisms swim against the current of the urine?
I think their conception is when the reason they decide to squat and not sit is because when you're peeing, you could, if there's force, you could splash, like the water in the toilet could splash back and then cause the UTI.
Yes. One lady told me that yes, when the urine is splashing into the toilet, some bounce back.
Yeah.
And they have now resorted to peeing while almost standing, so that it doesn't bounce back and reach them. So the research I'm yet to put up is, I don't know whether I can put a micro camera, that can watch whether the urine is able to splash back and hit and cause infection. That is something that is subject to research to find out that, though the facts are now evident that public toilets cause UTIs mostly in females. But then you find even a man saying that the public toilet has caused a UTI to me. And you're like, didn't you just point? Maybe when he was going for a long call and something else. But at least the fact is, public toilets are causing UTIs, and mostly in females. It would do us of a no service by just knowing that public toilets are causing infections without us mitigating or suggesting the probable solution to that. Though I have tried to tell my clients to have a different maybe bucket within their shops, they are working in malls, have a separate bucket, urinate in the bucket, you pour, wash your bucket, take it back. Though they try to as well disinfect everything in the toilet, but still again, one of the main causes is public toilets. So we had cleaning. The number third cause that I've seen in women is failure to have different towels to operate in different places. Yes. Ideally, a female is supposed to be having 3 towels. One for the face, simply because your face has too many chemicals that you apply onto. So you don't want those chemicals after you applying the towel on your face to take the chemicals somewhere else. Okay? 2, have a towel for your body, then 3, have a towel for your private parts. Okay? Because you will you will appreciate that, say for example, if this is a towel can get dirty, right? Or it gets dirty. Even if you have used it after washing clean, it still gets dirty. So where does it get the dirt from? From your body. So imagine you have used this towel from a certain corner and you cleaned your anus with that corner. Very well, people like cleaning themselves dry. So in the long run of you cleaning the anus very well with the towel, you might walk away with a few E. coli. But you will not mark that I used this corner when I was cleaning the anus. Now I'm going to clean the vagina and I'm going to use the other corner. You might do it today. How about tomorrow? So in the event that you use the same corner that you used to clean the anus, now you're using the same corner, you will have aided the E. coli to access.
But then what about the men? Don't the men also need that many towels?
The men, well, first of all, we don't. For us, it is wash and wear. I didn't apply any Vaseline on my face, so the same environment is the same. 2, the female urethra is adapted to having an infection because it is short, 4 centimeters. You know how long 4 centimeters is? And yes, this. And a man's urethra is 18 to 24 centimeters. So it's very long. So you find that by the time the E. coli crosses to causing infection, the lining has also antibodies. Okay? So the shortness of the female's urethra also contributes to easily getting an infection, a UTI, whereas me, a man, it may not favor. 2, the environment of the female reproductive part, it is ever moist, hidden, okay? So it creates even a much bigger environment. A man's organ is always there dangling, very dry, especially if a man is circumcised. The likelihood of him getting a UTI is minimal, though he can get an STD. But a UTI, it is very minimal because it is just a dry skin. So there's no favorable condition for the E. coli to flourish on a man's organ than
Okay. So now, for our viewers, I hope you have really now gotten details on what a UTI is, the causes, the signs and symptoms. So now I want us to dig into the myths that people have about UTIs. In your practice, you've said for more than 18 years. What have you heard from your patients? Some myths that they have that may not be true.
The myths that they have that may not be true is it does not necessarily mean that if a female has a UTI, the partner has a UTI as well. Because like I've tried to describe, some of the causes of the UTIs and the susceptibility, the likelihood of a female having a UTI than a male are very different. Yes. So, but in most cases, they confuse a UTI and an STD. So even if I give the gentleman medication. I would have given him the gentleman medication for free. Otherwise, do a checkup. Don't treat clinically simply because the female has a UTI. It's unfortunate that our diagnostic equipment aren't that. Otherwise, I would have gone ahead and done culture. If I do culture on your urine after me doing a urinalysis, and I have seen, yes, you have maybe pus cells, okay, maybe the leukocytes. Those are the parameters we use to diagnose a UTI on a simple urinalysis. I should go ahead and do culture to identify which organism. And if I find that the organism is the normal flora, E. coli, then I would know that she has it. Most likely it came from her, not from what?
The man.
Yes, from the man. But because we don't have those mechanisms of going to do culture to identify which organism caused the UTI, that's why we rush to treating also the partner. But it is also easy for you to tell the difference between an STD
and the UTI.
Actually,
could you help us differentiate those?
Yes.
In simple terms.
An STD basically is sexually transmitted disease. A disease normally has syndromes. Yes. And the STD affects the reproductive organ. The other one affects only the urinary system. This one affects the reproductive organ. It might also include this, but normally it cuts across both of them. When I say reproductive organ, it goes up to the whole vaginal wall. Okay? Remember here I talked about only the urethra. But here I'm talking about the whole vaginal wall. I'm going to the cervix. I'm going to the uterus. Okay? I'm going to the tubes. Okay? I'm going to the ovaries. And that's what we call a PID, pelvic inflammatory disease. As in, if it ascends upwards, it can cause a PID. So mainly, those structures are the ones that are affected by the what? By the STD versus the UTI. You see, they are very different. Yeah. And someone who has a PID presents different.
But there are some symptoms that cut across.
Yes, there are some that cut across.
If someone comes with just itching and lower abdominal pain.
Yes.
And you know that itching, most ladies cannot localize it. I don't know.
Yes. Itching, still again, it comes to which organisms is most likely to cause an itching. And mainly that itching. Do you know that when you have sex, and it is, say, for example, traumatic sex, you can have itching? And you know that I've been getting clients 2 days after sex, they are itching and they think they have a UTI. They think they have an STD. But that's not the case. If you're just because people don't open up and tell you this, I had maybe traumatic sex 2-3 days ago, and I would easily explain to you that when you have sex, there are those micro bruises that you get during the sex. And when those micro bruises are healing, like any other wound that is healing, you would get the itching. And it is self-limiting. By the 4th day, you're not itching anymore because you have healed. But because you've gone to someone who has not taken deep history, on the 2nd day you are a little bit itching, you rush to the clinic and they start you on treatment. Yes, but it's because you denied them information, or because they didn't know that even during sex you get micro bruises. Actually, it is through those micro bruises that you get. It can also happen to a man. After like 2 days, you find that he's a bit scratching. Yes, but it heals. It is self-limiting, and it is through those micro bruises that HIV actually traverses, because that's where you get the crossing of the blood from someone who is infected to the other one. So before I went there, I was telling you about the STD. Normally there's a discharge. Past discharge. To a man, actually men suffer STDs more than females. Yes, normally there is a past discharge. Normally there's always a foul smell. Okay, there is that normal smell that the female organ has. Okay, but this one is very different. A foul smell, and I should be able to tell that once I see a foul smelling discharge vaginally, then I know this is an STD. Then I know maybe this is chlamydia. Okay? Then there, even if I don't do culture, I treat chlamydia, maybe trichomonas vaginalis. Okay? Yes. So those are maybe the common, maybe Neisseria, gonorrhea. Okay? Yes. If I see maybe a man with an ulcer, a wound on the penis, or a female has a wound, maybe I think this is a chancroid. Maybe it is a syphilitic ulcer. Yes. So those are STDs now, not UTIs. Those are STDs. Yes. Then I know which organism. Maybe it is a decree that has caused the what? The chancroid. Yes. Maybe is it painful? If it is painless, maybe it is syphilis. If it is painful, maybe it is a chancroid. Yes. So now those are STDs. So it is easy. And normally an STD, its incubation period is 2 to 3 days. The UTI is in hours. This one is in 2 to 3 days. Yeah. And both complain of the similar symptoms. A UTI, one person complains, the other one doesn't. But most likely, an STD, both complain.
Okay, so I've also heard of or learned, whichever, of cranberry juice. Yeah, for UTIs. Do you think someone can take cranberry juice and be okay? Like if I am home, I notice, oh, I've watched this video, I have itching, I have little voiding little urine. Can I go and buy cranberry juice and be okay?
By the way, the other thing is, do you know there is a traveler's UTI? Yes, traveler's UTI. Someone has gotten the urge to pass urine, but is unable to because of the inconveniences. Maybe he's in a bus, maybe he's very busy working, and the bladder gets full, okay? And have you ever put urine in a cup for long? What happens to the urine? It's the ammonia, you start affecting the walls, okay? And you get a cystitis simply because you delayed to void the urine. Yes, so there is also that cause I had forgotten about. So that juice you're talking about, really, treatment of any infection requires an antibiotic if it is a bacterial infection. Though hydration is very good. It's very good because you aid the bladder to keep on flushing out, okay? It's also a defensive mechanism. Because once the bladder fills up, it doesn't give favorable condition for because we have microorganisms that are there, but if you let them concentrate, they start causing disease. So one of the defense mechanisms of the bladder is to empty it as soon as it is what? So in your emptying, you flush them out. So when you drink lots of fluids, you aid the bladder to keep on flushing the micro. So there you'll be preventing the what? So I would advise those ones who are taking the juices, well, not necessarily. I would mention the juice because I know as you're taking the juice, you're taking the water as well. So if you have that belief, I would encourage it and say take 3 liters. But for me, in the long run, I will have achieved knowing that you're taking 3 liters of water and it is going to aid the flushing out. Yes. Basically, that is the how you can treat. But for me, I will call it preventing. But treating deals with medication to treat the infection.
Antibiotics.
Yes.
So to our viewers, hope you've had that. We'll expect you, when you see the symptoms, rush to the nearest facility to get help. So we have come to the end of the episode. Yeah. So I want you to just give closing remarks, anything you feel like you want to tell the people out there concerning the UTIs, anything we have left out.
Before we close, this goes to our fellow health workers. Okay. When you do a urinalysis, there are some things that you naturally will find in a female urine. Epithelial cells. And normally you see 2, 3, see 1 epithelial cell. That is a normal occurrence, for heaven's sake. The other part that I wanted really us to talk about is UTIs in the elderly. The elderly will get UTIs more often. Plus, when you're in your periods, you'll get UTI. You might get UTI when you're in your periods. Simply because we have the female reproductive organ is mainly controlled by hormones, mainly estrogen. estrogen is a very good hormone in that it encourages a certain normal flora within your vagina to keep on secreting hydrogen peroxide, lactic acid, and it gives it the acidic environment. Now that acidic environment is very important to keeping away other microbiota from growing. Guess what people do? They use soap, things they put them when they are cleaning, okay? And all those change the environment that naturally is supposed to be preventing. That causes infections as well. So part of the cleaning is don't go beyond water. Water is enough to clean your vagina, and it will be very clean. Actually clean up to when you feel some gritting. Then you know it is clean, okay? But people go as far as even putting their soap. And once you've put soap, you've changed the environment. Then in elderly, they are likely to have UTIs because they hit menopause. And menopause, your estrogen starts going down. And estrogen is what is responsible for those secretions, okay? Now, the pH changes and it starts rising because the pH of the vagina is between 3.5 to 4.2. So the moment it starts raising to 6, 7, then you change the environment as well. And now, the microorganisms that fail to survive with an acidic environment starts flourishing. So that's why you are more likely to find a UTI in the elderly, and they normally come with all those systemic symptoms because they stay with them for long. So that is what I wanted to crown it all. In our practice, never miss doing a urinalysis in someone who is in menopause or the elderly. They suffer from UTIs as many times as possible. Yes. Then 2, polypharmacy has caused drug resistance in our managing UTIs, and that is why you find someone is treating UTI for even like twice a month, okay? Simply because he has gotten used to all the drugs. Immediately you go to the health facility, they are giving you ceftriaxone. They are giving you all sorts. You do a culture and sensitivity, and someone is only sensitive to meropenem, a very expensive drug which he can't afford. So over prescription of unnecessary drugs from us, the health workers, has also caused the exacerbation of UTIs in these females. Yes.
Okay, thank you so much, Dr. Lawrence. We are so happy that you've talked about this topic. I'm sure people out there now have a bigger idea on UTIs and misconceptions have been cleared. So to our viewers, thank you for staying with us. If you've reached this far, thank you so much. Hope you've learned as much as I've learned. This remains the My Doctor podcast. And yeah, my name is Mwesigwa Joy. Stay with us.
My Doctor, your health anytime, anywhere.